I've been using the NEWS score for a couple of years, now NEWS2. And the reason for it is actually, in a couple of weeks, it's my 30th anniversary of starting as a GP in Medway. And after 30 years, I've come to a conclusion which is general practice is ruddy hard. And that I have feet of clay like everybody else. You cannot be perfect and know everything. And so there's 3 reasons for using the score as far as I'm concerned. And ultimately it does roll into better patient care and safety, but it's partly about keeping my own sanity, because even after 30 years, I still have some evenings or nights when I wake up in the middle of the night thinking, oh, did I make the right decision about that patient? And that's because general practice is not black and white. It's mostly grey. In fact, my upcoming autobiography is 500 shades of grey. And yes, you have the patient who is apparently utterly fit, and you do all the checks and there's nothing. They've got a sniffle. And you know darn well you're not going to need to admit them. Other end of the spectrum, you've got the moribund patient, and in children, my measure is if you can get them to stay still long enough to get the pulse ox reading, then they probably need admitting. And so I use NEWS as a way of supporting my decision, whether it's to admit or often actually not to admit. It gives me a little bit more confidence. The second reason I use it is entirely selfish, and that is because I have discovered that junior doctors, now they know about this, respond to it. And so instead of that 20-minute argument about where they're trying to get you to say precisely what's wrong with the patient and you know what their inside leg measurement is and that sort of thing, you ring up and say, this person's NEWS 9, and they go, okay, send them in. And I'm very sad to hear you didn't get treated with priority. I don't know what happens once they get there, but certainly my patients seem to have done well. I also use the Sepsis Trust tables you can get there. They're online, which are very helpful for children, for example, under 5. And they even have triage forms that actually guide you so you can tick the boxes and get an idea whether you should be perhaps assessing more urgently. The third one, and it's back down to me not having a nervous breakdown, is to do with complaints and litigation. Sepsis is a condition which is deteriorating. And there's a sort of golden zone where they're bad enough that you can spot something's wrong, but they're not so bad you can't do anything about it. Unfortunately, often, certainly with my patients, they're rolling in with the first sniffle they've got. And at that point, they're looking okay. Trouble is that every so often, one of these is going to deteriorate over the next few hours. They end up in hospital, and the next thing you know, there's a complaint on the desk saying, why didn't you admit my mother or whatever? She had sepsis, you should have known better. And for me, actually having a score like this, which can say, look, I did this score, and this is what the score was. And so at that point, it was saying that they are low risk, and that was what I based my decision on, allows me to defend myself. I am certainly not saying that NEWS replaces the sort of spider sense that we have as GPs. I think after 30 years experience, you can look at some patients and go, you know, okay, although there's not much, there's something about them I don't like the look of, and I need to admit them. And I think you should still respond to that. And it doesn't beat all the other examinations and so on. I haven't found it takes a lot of time. If you've got EMIS, there is a NEWS score. I'm not certain that it's NEWS 2 yet, but there is a NEWS score in the templates. I don't know about vision. And if you're going on visits, see if I can get it to work with my face recognition, there we go. There are apps, this is an Android one, literally tick the boxes and it gives you a score at the end of it. And likewise, you can download the PDFs for the kids. So that's why I use it, that's why I think it's worthwhile using, and I'll leave it over to you whether you want to do it.